Hi, this is Teresa Spangler, CEO of Plaza Bridge Group and host of FutureForward. And I have Ryan Douglas with me today. I'm really excited to be talking to Ryan and also learning much more about what Ryan has delved into recently. I think is very timely. We'll talk a little bit more about that. But Ryan, you're an inventor, you're a medical device expert, specialized in light therapy, which I've seen, I think some of the technologies you invented maybe a few number of years ago, but you've focused a lot of your attention on treating anxiety and depression and stress, and it's so prevalent today. And I think your former company was, you had a successful exit, was that Nextern?
Nextern, yep.
Yeah.
Yep.
And so
They're still up and running, hundreds and hundreds of people strong, doing really great work in 4 different countries, designing, manufacturing medical devices, and just bringing new technologies into being, and really sustainably into being, not just innovating,
yeah.
but purposeful innovation all the way to getting them in the hands of folks that need things.
So you're sort of launching into all the things I love and want to talk about. And I also want to make sure we get to DeepWell, which you've got over 40 game designers, medical researchers, scientists. And we're going to talk about this, but building, this immersive gaming environment, which on one side, we're hearing, and I'm seeing so many articles on the addiction side that kids are getting into, the game, right? And I want to come back and I know you have a lot of information because there's so much treatment for depression and ADHD and all the different things that this technology could do. So let's first kick off and say, where the heck did the motivation to come from to want to tackle this very challenging, this real challenge people are having?
I think in the end, I mean, there's a couple of things. You can go all the way back to being a child, and I was a tinkerer. I have my own challenges as being someone somewhere on the spectrum. And I was really connected to building and making things, and it was actually really unsafe for my mother to buy anything new, electronic, VCRs, telephones, all that kind of stuff, because I'd take them apart and put them back together into something that I thought was much better. She may not have agreed. There's a lot of duct tape involved, but I just right from the beginning, I wanted to make things. I was always driven to make things, and I was also always driven to help. Like it was. It's sort of a central theme through the work that I did before being involved in medical device and those sorts of things. It was defense robotics, but always things that help. So not things that blow up, but we did robots that would go and whether or not there was a bomb, and there were these little tiny guys that, or a threat, anybody could use them. You just throw them in there. It was called Throwbot, and we got them deployed in Afghanistan at a time of great conflict, and they're saving lives, and knowing that technology was just capable of exponentially increasing humans' ability to do things, or increasing their safety, sort of their health, wellness, and safety was just something that it hits me in a way that I get up. It's the purpose that makes me want to go.
Did you have a specific person that was more inspiring to you, or a mentor like to you in early age?
It's kind of interesting because I got pretty deeply involved with technology early on, and it sort of actually went the opposite way of that. As I emerged into business, what I encountered in those people that mentored me early on really were folks. They were probably less belief in collaboration. They were very mission, vision, values driven, top down driven leaders, and I would try to emulate those leadership styles early on. I was a COO and promoted very quickly in my 20s, and involved with venture-based business early on. But it never felt good, even when we got results from that. And when you give someone who's on the spectrum this sort of like, who might look at things black or white, it's like, this is how you do it. I had one CEO say to me once, one who was one of my mentors, they're like, wow, you get stuff done, but there's a wake of bodies behind you when you do it. And I was like, and it didn't feel good to me either,
Yeah.
Because interestingly enough, he was the person that taught me that as well, but he did it with charisma, but the same end result. It wasn't really great for the
right.
Lots of pitting people against each other in what seemed to be positive competition, but really, all those things. So it was more going through that, having one venture-backed business in my 20s that it didn't feel good. It never felt really great. And then saying, well, how do we do different?
Well,
You know,
and you bring up a point. So I'm going to dive into this a little bit because you're saying, in one hand, you get the same results doing it where people are at the center versus you're leaving this wake of people. So if you're getting the same potential results, and that's probably a question, were you, right? And if that's the case, why do leaders feel like they need to go on this other journey?
there's a lot of answers to that. But let me back up and say, I was getting great results, but these were at startup companies and they weren't yet at scale. And
Yeah.
so you can only carry things so far with one individual. And the more that I wanted to be involved with this very multidisciplinary world, neuroscience is deeply where I'm engaged right now, and what that has to do with AI and
Yeah.
robotics and automations and all those sorts of things. You need a room full of subject matter experts to get that to go. You
That's
talked
good.
about light therapy, and people think, well, it was hilarious to people like, that's a light bulb in a box. What's going on there? Why is that hard? The reason that our company was able to literally, win that market, and become the predominant brand for light therapy across North America was because we recognized it was multidisciplinary, and we built a multidisciplinary team, right? And it turned out to be a lot harder than you think. The doctor that knows all about your eyes and what's going to happen when the light hits your eyes is different than the doctor that understands what's going to happen when the light triggers your brain.
Right.
Different than and then there was electrical engineers, mechanical engineers, firmware engineers. Like there was, production engineers and process management people, and we brought them all together, and we were able to make a very effective light box that people could buy for $29.95. And that was a great accessibility to care play, like a massive accessibility to care play. And then we involved, we got great partnerships. Our Costco partnership was out of this world for distribution, and Dr. Norman Rosenthal, the grandfather of light therapy, the guy that defined light therapy, he came to help and endorse us, and ended up on the box and supporting us. And all of these things happened because of the confluence of folks that were involved.
Yeah.
If you do that singularly, could you, and that was a small market, could you win it? Maybe. Would it be won in a way that was absolutely the best for the patient? Would it be truly patient-centric? I don't see how that's possible without a lot of people.
Very good point. Yeah, very good point. Well, did you have to get venture funding for this?
No.
So you self-funded it, or
I've been venture funded once in my life. It was in my 20s. It was not a super positive experience. So I, at the time, this was before the dot-com bust, and it was very gold rushy. I think we've just gone through this again, actually, a little bit, and maybe correcting from it now. And so after that initial company, which had a lot to do with multimedia and a product called Flash, and how music could be tied to vector imaging in a way that you could actually do multimedia back in the time when people had very little connection to the internet. Kind of moved out of that, and from each time after that, from the little bit that we were able to do from that company, we self-funded and grew ourselves in various ways. And in the case of Nextern, we never had any outside funding. We never had a board. We didn't have a
interesting.
We didn't get a loan. I pulled $150,000 out of my house, and it grew to hundreds and hundreds of people, and very, 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 very robust revenues, and profitable by being very collaborative and not really being overly focused over there. So now with DeepWell, it's the first time we're actually back again working with some venture partners, but very different folks than you've seen before. They're much more purpose-driven.
Yeah.
And that's because of the scale of the problem we're trying to solve.
Yeah.
And the speed by which we're trying to solve it. So Nextern did amazing things over 17 years, 27 devices that were put in field during that time, like just really big numbers for.
Sure.
But it was 17 years. And when we talk about mental health, we don't have 17 years.
Yeah, we don't. I know, it's true. Yeah. And it's getting worse. We
shouldn't be confused what we're seeing right now. All of this harm that people are putting upon themselves and other folks, that is the result of people being disconnected and afflicted with major
Yeah.
depressive disorders, anxiety, stress. And there's no question what we're seeing. And that's why you're seeing these 100-year rates for depression, but also for, violent crime and all these
Yeah.
other main centers. We were in a mental health crisis before COVID, a very bad one.
Yeah.
And then this was such an accelerant. And I think what a lot of people don't understand about mental illness as well is that we're still going to be experiencing this on a greater level. As if we are truly coming out of COVID, that's actually the time when more mental illness will trigger and come in. If you're being chased by something scary and terrible, you outrun it in the moment and you live in that moment full of adrenaline. And that could be even for years. But when the thing that's been chasing you finally subsides is when the panic actually sets in and when the long term. So we're just on the crest of what is a wave of mental illness that is going to be incomprehensibly large, and there is no country in the world that's ready for it.
Well, I want to get into the technology, but I want to first kind of talk a little bit about the challenges that you face, maybe in the former company, which still is doing very well, in getting to that success. So what did you face, and then how did you overcome some of those challenges? Because I think CEOs and founders and leaders experience incredible stress in times of trying to build a company. I know myself, and you have to find those outlets. So
absolutely. I mean, neurodivergent, which is I think a lot of us are, whether we want to admit it or not, only makes it harder. I often try to, because I'm someone who cares deeply and I care deeply for other people, but depending on how I communicate something, that may not always be felt or heard.
Yeah.
It's sometimes I explain, just talking very personally about this and the spectrum side of this, sometimes I feel like I'm a person who's been put into a room full of all of the most important people in my lives, pretty things. And as I'm trying to move through it, someone turns out a light. And even now and then, some not good person moves one of the pretty things. Sometimes that happens. And so that challenge alone in leadership, who you are and how you're present in that moment of leading, that can be everything. And I had an amazing team who we stuck together through thick and thin, starting in defense, translating all the way over to medical device, deciding together to make that change about what we did because we wanted to do things that helped.
Right.
And that mattered. Who also provided me a lot of space to grow.
Yeah.
Right?
Yeah.
And I very much did go through this very transformational thing where it was about me and about what I could do and feeling very much the company centered on me, to this place where learning that the best thing I could do was surround us with people who were subject matter experts in every one of their fields. And therefore, as a result of that, no matter who put the idea on the table, by the time we were done talking about it, it was better than it ever could have been if it was me, by a lot.
Yeah. So in this world where have hybrid work environments or remote work, in some cases, people having to go back to the office and they don't want to be there. But you keep talking about team, and I understand that completely. It's like these people around you can be an incredibly inspiring, motivating, collaborative environment to help you individually grow. What do you tell people that are struggling to put that sort of network of cheerleader squad around them?
So can I take you back a little bit to where my transformation came from and what I've been leaning on ever since? Around 2012, we'd really been pushing hard. We had commercialized some devices and we had some home runs. And I tried to codify the way that we would do those home runs. Tried to systematize what had been a very free-flowing, very positively reinforced, but never defined environment. And went Six Sigma on everybody's butt.
Yeah.
And we went from hitting home runs to hitting singles and doubles. And I thought, a lot like a musician who's had maybe a one-hit wonder or two hits, that my time might be up and that I maybe wasn't that capable. And I got invited and got involved with an individual named Daniel Kraft who was running something called Exponential Medicine, and he's just rebooted this thing as something called NextMed. And I got invited to go to this thing, and I met a bunch of amazing people. But I met this one guy. His name was Dave Zabosky, and he's a former Disney animator. He did a lot of things, but he was part of drawing the genie and Aladdin and all this kind of stuff. And he had, interestingly, from an artist perspective, he had looked at how Disney had worked when there was 200 of them running around and no computers. They were all these very iconoclastic, crazy, wonderful people had to make all this stuff come together in this way. And he had come up with this thing he called the 5 keys to creativity. They were a little Californian in nature, sort of Eastern religion, but in the end, he had unwittingly codified what I believe is the natural order of how creativity and innovation reaches a organization. And so I came back from meeting with him. I met him at the show, we jammed a bunch, and like he starts talking to me, and I'm like, here's a Disney animator, top end innovator. And I asked him, I'm like, at this point, part of my codification had been really that people expected us to get things right in one shot, get the budget, get it done, get it out. We were doing a lot of defense and consumer electronics, and there was no time for mistakes, and everything had to happen. If you didn't ship for Christmas, it didn't, and even our medical devices, the few we were touching at that point were very over the counter at that, and very hot cycles. And I had built this really tight mechanism, and now we're not hitting home runs, we're hitting singles and doubles. And I just said to him, like, at one point did you get so good, Dave, that you could nail it out of the park in the first hit? He's like, never. He's like, iteration was a key element to success at Disney. And I will only talk to you about how many passes it takes to get something done. And when he told me that, like, he told me the evolution of several of the movies he had worked on where the titles had even changed and all of these things had changed at Disney. I'm standing in this VIP room in the Hotel Del Coronado talking to this amazing man, and a tear starts coming down my face because I realize the pressure I've put on myself and the pressure I've put on this team is actually making us less successful. We're not giving space.
Yeah.
So when it was all said and done, he summed it up like this, if I may. And then we worked, by the way, we've worked on this for years. We've been writing on it for years, maybe someday a book, but we've been doing it as lived experience together. And I became his translator to the business world, because everything he was saying was very artsy and almost sounded Eastern religionist. You can imagine I'm working starting to work on medical devices in the Midwest, but in the end, it came down to this. You needed to build a belief mechanism, first of all, around the entirety of the people, where you gathered people. It wasn't about your vision. It was about putting something out there that was passion there, that drove everybody to come to a common purpose where they would be aligned with what we were off to go do.
Right.
Built our belief mechanism.
Right.
From there, it was about how we collaborated, which turned out to be a reimbursement mechanism where you plus one another and you drive things up, and you make sure that the person that finds other folks within an organization to accelerate their idea is celebrated as well. Everybody is celebrated up and down the chain of innovation. The iteration had to be managed, which turned out, I learned as a business person, meant budgeting management. It meant how many passes and getting out of the linear stage-gated process of developing products. Because innovation happens as a spiral. You come in closer and closer and closer in passes, and it is an art and a science, because if you look inside a spiral, there's a spiral. And when good is good enough is important. But if you turn a spiral on its side, it's not this linear, develop this, then develop this, then develop this. You're over here, then you're over there, and you're over there. And if you're expecting linear, what most of your fairly introverted engineer type people or creatives are going to do is they're gonna kind of not be honest about where they are in the process, because they're going to feel like they're always off a track. And they're going to be so driven, they're going to keep pushing it through, and they might miss purposeful innovation, or they're going to be so intimidated they might actually leave because they feel like they didn't follow your process. So that iteration really managed. And then we got deep into risk management. And risk management was not what everybody thinks at FDA and thinks about the company. It was the individual innovator. If you underutilize somebody in their prime time of their ability to create, you don't allow them to ascend to the place that they could possibly be.
So great. Yep.
If you overutilize them, you put a monkey on their back that doesn't allow them to make the leap. And
Right.
we started thinking about risk in terms of that individual. Of course, we thought about product risk, and of course, we thought about health risk, and we did all those risk analysis, but we thought about individual risk, and that put those innovators in place. So when you have a belief mechanism with where people can truly collaborate and be rewarded, iterate without being punished, their own risk is being managed so they can be in their best place to innovate. Then the final, and what I'm going to say most important key falls right in. You must complete.
Yeah.
70-80% of things that are funded don't finish.
I know.
And when you don't finish, when you finish, you get the feedback from the rest of the world. Even if it's negative, it's the most important message, and you can put it back into the belief mechanism, run it back down the system,
Right.
and you're going to get closer over time. And every time you know something more now that the industry doesn't understand, even like what didn't work. And so driving to completion, which is also, it's a project scoping problem. It's not the end of the project, it's the beginning of the project that allows you to complete.
Right.
Always, not always, but you see a lot of people, they overbite the apple, right? It's like, oh, and we can do, especially when you talk about AI and anything that can get exponential, people go exponential really quickly. And we start going, what is this core thing we're trying to do? We would push them through in its entirety. By putting that together, our culture shifted considerably. We didn't, so Nextern ceased to have any clients. It had only collaborators. We didn't charge for our engineering services beyond cost. We actually worked together, and we only made money when we commercialized together, and that brought us a different seat at the table, a different way. And we didn't end up with a sales team then, because people came to us to get one of the best medical device innovation teams, and we were a great second vet for them. If we didn't see opportunity where they were going, that was a good back and forth. So it was a pretty big shift, and it really changed us as an organization.
Well, and so that iteration actually sounds like too, it was a personal iteration. You were shifting and growing, iterating your own abilities and skill sets as they're bringing this whole team together around that methodology.
So totally. There was a feedback mechanism that if you were being honest, if I was being honest with myself, if you're being honest with oneself, we could see that we weren't what we weren't,
right?
And our intent wasn't landing where we wanted to be, but we didn't have any metric for it. And I think most companies don't have any metric for understanding. It's like, why are we not who we were? Well, we never knew who we were. And oftentimes when you try to systematize, you might actually drain some of the lifeblood out of the thing that was taking you there in the first place. Not that you shouldn't do it, but understanding the natural order of creativity, seeing it as a force, like gravity. Like, I mean, creativity is all around us. I mean, I don't care what your religious belief is. If you watch the evolution of a tree or an ocean or a forest, it's responding to the rest of the environment in its way that has to keep reinventing itself so it continues to be.
Right.
That makes it a natural force. And I think we don't think enough about it like that.
No, I completely agree. And I think we get stuck. Well, a lot of the, I would say, kind of clients that we've worked with, it's always about the budget first. And when we kind of take that off the table and like, all right, well, let's not make it about the budget, because we could probably do it for nothing if we had to. Let's figure out how we do it for no budget and take these small iterative steps together. And it seems to open up the world. And I love the methodology. I love the fact that just the way that the steps, just even to the last one, the risk analysis, it's not about the risk of the innovation necessarily. It's about the risk of the individuals not being able to put their full selves in it. I mean,
that's right. The individuals, they are going to bring you that innovation that you're looking for. You don't have to manage the risk of the project if you manage the risk of the people. If they're the right people, they will in turn manage the risk of the project.
Yeah, love it.
You do need to manage the risk of the product, making sure that's safe.
Absolutely.
I think that once you understand that innovation is a power, and creativity is an element and a force throughout. A force, I think, is the best way to put it, throughout our world. Then you can look at it differently. I mean, what is a known force? We know gravity is a force.
Right.
What if I said to you, Teresa, I want you to start a new company. I'm going to fund you really well, but I want you to do it without gravity. Right away, you'd be like, well, what do you mean my pen's going to fall? How do I keep my stuff down? How everybody's going to be non-productive? And we do this all the time with the creativity and innovation. We feel like the processes that are used often to kind of keep leaders at bay, or keep them in the, keep them corralled in, like, I'm going to give you this much time and this much this, which is mostly about administration trying to keep up with the innovation process. We believe that is the fostering of the creative and innovation process. That's maybe the management of it. So no one even addresses it necessarily. And so it comes on naturally, and it happens when a bunch of people are passionately driven for a purpose. But if you didn't work on that belief mechanism in a way, and that starts to wane over time, or it turns out that passion leaves because it's more about who's involved, then all you're left with is a process that maybe actually drains some of the productivity out of the company.
Well, first, you can clearly see your excitement on innovating, and certainly with people at the center of that, which I love. Let's talk a little bit about DeepWell, because I do want to go back to now the question of, or actually ask your input. So on one side, we have this addictive gaming and young kids and teens, and from there's the gambling side, which kids are losing money. But there's certainly this addictive side, and I had a former individual friend that his son got very addicted and had to take some steps. Not at I would say in their late teens and college days. So on the other side, they have what you're creating, and that's something that is potentially healing, helpful, and restorative. How do those two things differ?
Completely. And that's the first thing that I start to say right away. I want to be really clear that there are things that are happening in video gaming and in media that use energy dynamics in an exploitative way to separate people from their time and resources, and an undue level. Because it turns out those things are none of the characteristics that make a game wildly medicinal. But they are. And games have been, for 20 plus years of research, 40 plus years of being created, they have been helping a lot of people. And we can talk about how they do that in a minute. But I do want to be really clear about this. There are folks, and a lot of them, you see them in free-to-play environments and things like that. There are people that deploy, and companies deploy psychologists, and they deploy slot machine designers, and all these behavioral scientists. They're not doing what we're doing. They're figuring out how to put an addictive hook into what they're doing and pull you in. And they do that a lot by something called energy dynamics. And what that means is the game draws you back in to preserve work you've already done.
Okay.
Yep. That's a very important part. And it deploys social and time-based constraints to separate you from more of your money. You start to get pressured by your own team. Now you need the sword of Andromeda, and that sword is $59.95. But if you get it, you can help this entire tribe that you've joined, that you're socially connected to. Those sorts of things, those energy dynamics. And then you'll see some developers, Ken Hall's one of them at Two Dog Games. He just had an article in Wire, and he and I were just talking about this. He deployed the opposite energy dynamics. He makes your character get tired if you stay in there too long, just like real life.
Yeah.
Now we are intentionally saying things with a beginning, middle, and end, even if they're worlds. I don't mean a beginning, middle, and end like to the world. I mean a beginning and middle and end to your interaction with it for today.
To the story that you're in.
Right. That's right. Those things can be very powerful and can be very attractive and very dopaminergic, which we need them to be good treatments, but we don't need them to be infinitely dopaminergic like a cocaine addiction. Matter of fact, we actually need dopamine with what we call a serotonin chaser. Serotonin, I mean, this is a very simplistic version of it, but this is, the idea, the dopamine gets you excited in the moment to do the thing that you want to do, so much so that you get doing it, and it brings you a bioavailability to learn. But to make that a preferential neural pathway that you've delivered and have you come back for a positive reason, you need that what I'll call the serotonin kicker, which is the idea that you reflect on what you've done and you like how you got there.
Yeah.
And that doesn't often happen for most people who, let's say, end up in an addictive situation where they're, wearing diapers and eating Doritos for 18 hours to play a game, or losing their college scholarship. Those are not the same principles.
Right.
And so people, I've been asked that a lot. They're like, well, all of those great things that games do, they also addict you. I'm like, no, they're two different things.
Does the responsibility lie in the game? And I love games, so I don't have anything against the gaming world. I do believe responsibility and thinking about the age group and that you're targeting. But does the responsibility lie there, or with the parent, or with yourself?
I think it lies in all those places.
Yeah.
I mean, the creators have responsibility, and I think what you're seeing is, I'm new to the gaming world, but working with Mike Wilson, my primary partner on DeepWell, I mean, that's been his whole life.
Right.
He's always worked in the indie world, and you meet these folks, these creators of immersive experience, that their true intent is to share with you something.
Mm-hmm.
They often design it with a beginning, middle, and end.
Yeah.
They often ask you to pay for the game up front versus making it free and then drawing you in more and more and more over time. They're just saying, like, look, I have a thing I would like to exchange with you. I have this experience to give you. You have these dollars that will help me pay for the fact that I've done it and pay and feed my family.
Right.
We would make that exchange. That's very different than something that, it's like, we're gonna bring you in a little at a time.
Yeah.
And so it has a pretty different dynamic. But I'm seeing more and more what we're seeing at DeepWell is that these folks are reaching out to us and they're going, we want to know how to build with intent. Mike calls it like.
Well, I was going to ask you, do you help game? Just okay.
We're starting to. I mean, we really have been focusing on our own systems and processes and our own internal dev to get going with, because we wanted to refine. You can't sell somebody something that you yourself are still refining.
Right.
We are getting to the place now where we can bring create value to other devs as well. And we are collaborating with them so they can build intent. They can both increase the medicinal quality of the game and be careful about incorporating or understand what happens when they incorporate some of these other mechanics, and being careful that they are that they understand that the intent that they're going to. Mike calls it media nutrition, and he thinks that it's a lot like how nutrition has moved. We've become educated over time why it's not a great idea to eat McDonald's every day. We're not suggesting that we should shut down every McDonald's. And we're also not suggesting that every body responds the same to McDonald's. We're just saying, look, this is how it generally gets going.
Well, maybe there should be the same criteria. We have calories, carbohydrates, and all the different things and ingredients, and maybe the gaming industry should have some of that. They do some. I guess.
I'm going to see more and more of it over. I mean, there was a rating system. The problem with the early on rating and even the World Health Organization showing up and saying, look, game addiction they called it an addiction, and they called it out specifically as one. They skipped a lot of other things that are also addictions, and there's still a lot of question out there whether or not it's disease or is it a symptom of other disease.
Right.
And there was a lot of, I don't want to make this political, and I don't want to make this, but if someone isn't so inclined, they can go figure out where all the way back in the 80s, where this sort of suppression of video games came from. And you will definitely find that it was motivated by folks that were looking for social controls, and that then the early things that said these games are going to make people, just apathetic towards other humans and killing machines. None of that was accurate, not even close. And I mean, it was so wrong. It could have been Freudian, So the intent wasn't from the right place either. So there is that, and that's been in the way. And then there is the very real reality, which is these folks in gaming have figured out how to be very, very compelling, which can be super powerful. And like anything with a high degree of therapeutic quality, if you look at the boundary conditions, you'll find harm. Anything can help you. If you do none of it or too much of it, you're going to have a problem. Then it becomes how much margin for error you have. Talk about light therapy, you have a lot of margin for error with a good therapeutic center. If you talk about fentanyl, the therapeutic qualities, they're there, but they're so tiny they can't even be managed by a human, which is why it's very dangerous for it to be out and used recreationally is out of this world, as a bad idea.
Well, so talk a little bit about DeepWell, and this is something that is going to have a positive effect on people. So can you share a little bit about how and what people should know about what the outcomes could be using some of the products you're building?
Even more so now than I've been able to for a while, because though we've been at this for a couple of years, we were a loosely banded group of people that understood and started looking at the back research and understood that there was a powerful mechanism here for delivering therapies in gaming. Along our journey, we found out not only was it a great delivery mechanism, it turns out to be a great therapy too.
Okay, yeah,
It's the way to get people to do things. The
right.
very act of play and fun turns out to be a fast accelerant to learning and a very positive way to impact people's own self-image and change their stories internally and have them rethinking and even change how their autonomic functions might work, how you might respond in a panic situation, how you might respond to a difficult or untenable
Very interesting.
condition.
Kind of military,
Yeah.
somehow I have military's training.
Well, very true. As a matter of fact, one of the things that we used as part of our predicate work was a military individual who had a whole platoon that was reporting to him. He was blown up and he lost his leg, and he started using. He was passing out, and everybody was getting hurt, and he had the radio. He had to call for help. And he started using deep breathing techniques. He got everything under control, himself tourniqueted, the chopper called in, and his folks safe, and then he passed out and he lived. And everybody always fascinates. They're like, well, yeah, I mean, look how powerful breath work is. And it's very powerful. But the thing that we focused on that I thought was really interesting is how did he think to start breathing in that moment when your leg is blown off and the world is getting crazy around you? That's what he drew in and started to think about what kind of neural pathways must have already been created and sitting there in an autonomic functional capacity that when all shit went crazy, he actually, could access that training. And so in that way, we were very interested in that. And that's a lot of what we see is it's not just that how to better, let's say, do breath work, or that we can improve how motion works, or that we can incorporate cognitive behavioral therapy. It's that we can get you in a place where when we feel like we can get you in a place, and that's what we're looking at now, when the shit hits the fan, that you trigger something different as a response.
Right.
Or
a little bit of, I mean, you talk about neural pathways, and so diving in a little bit explanations for people that may not understand that, but it's a little bit of training, I guess, almost like in its form.
Yeah, our brains. Our brains are super neuroplastic. Because you and I talked today, because of this exchange we've had, and because of the ones we've had in the past to get to know one another, our brains will never be the same, which is why you're really careful who you hang out with. But it, and so that's the same sort of thing here. These exchanges you're having, you're always making these new neural connections, these new neural pathways, and then depending on what neurochemicals you make during that process and how that evolves, they may well become a preferential pathway.
Right.
You're talking about something your body just does. Things went cruddy and you took a deep diaphragm-based breath, and that caused the cerebral spinal fluid to circulate and gives you a moment and gives you vagal nerve stimulation in a moment to make a reflexive or a good reflection on what the next choice is. Or you have a moment where the self-talk is negative and something scratches the record at that moment and says, no, I'm not bad. No, I don't suck. This situation sucks. When that happens, a neural pathway that's been firing, something over here fired. What sets that up? What makes that happen? It turns out, as humans, we are very great at learning how to do things when we play. Matter of fact, if you look back if you're going to grab your kiddo and you want them to learn the alphabet, or you want to learn to talk, or you want them to learn to walk, do you make it work? Is it a 9 to 5, or did you play your way through that with positive reinforcements and come to mommy and big smiles, all the things that they are just like, they're getting neurochemical rushes as a result of that. Somewhere around 5, we decided to start telling our kids, work hard, play hard. And so I think, and I think many people think, when I say I think, it's because I read other great people's work, not because I am the or the originator of this thought. I don't think neuroplasticity really goes away in adults the way we talk about it, where it's like, oh, it's so much easier to learn a language or this and that. I think our way of approaching learning changes so much that we can't access our brains the way we did before.
Interesting. Okay. Good point.
The cognitive brain is not designed to teach our subconscious things, really. And you can tell that if anybody's ever taught you how to golf or ski or play tennis. So you're told to do all these motions and actions and stuff like that. You get worse in the beginning trying to think about the controlling of smooth muscles and like all and musculoskeletal response that needs to be more ingrained. I'm not saying you can't do it this way through the cognitive, and down into the hippocampus and around you go. I'm saying it requires devotion. That's why you see people practice all the way to devotion. But when you play your way in, it may not take that same amount of energy to get the same amount of learning and response.
And doesn't it, so much of our history forms, from early traumas or, from things that happen in childhood. So do you recommend that counseling first and then there's these technologies could help, or could the technologies help?
Well, we're trying to do it. It's really important for me to say this. What we're talking about are adjunct therapies.
Okay.
Help in addition to, or help early on. So where we're trying to land at the moment is catching you when you're in a mild to moderate symptom situation.
Right.
As what we're acknowledging is accessibility to care is broken.
Yeah.
You want one more thing that a doctor has to write a script for. You can't get the doctor. You can't afford the doctor. You can't get the doctor. Doctor writes you a script. You can't get it covered. Right. And then on top of it, that thing you get a script for has built a business model that needs you to come up with hundreds of dollars every month or something like that because they thought they were going to get reimbursement that they're not getting. Now you're paying from the individual. That's all a problem with accessibility to care.
Right.
That's all the reasons I left the medical device industry. I didn't come back to do that again. Gaming for the mild to moderate folks that are dealing with stress, anxieties, and symptoms of depression, not depression or major depressive disorder, but early on, gaming can get you in a place where maybe you don't descend, or if you're starting to descend, you can elevate yourself back up and have a self-care portion of the situation, right? To relieve those doctors who are overwhelmed, dealing with major depressive disorder, bipolar, schizophrenia. I mean, these are things and people that are getting close to suicidal and having suicidal ideation. We don't have machines for that. So we need people and touch for that. So we're trying to deal with this accessibility to care. Model the way that you come up and you buy a game, and that game, it tells you that it can help you with a certain thing. It also is a really good yardstick. If it isn't helping you, it might be a really good time to go get more help.
Well,
and you want to do that for a price that, listen, accessibility to care isn't really about having a machine or having a phone and then being able to pay $30 for a game. That still excludes a big portion of the population, to be honest. But it's better than anything else we've been able to do today.
I totally agree with that. And so I want to make sure people know how to get, to your site. We'll make sure the links and all those things are included in the bio. But is there anything you want to share now that tells people how to access the tools?
Our first game, so a couple of things. We did do a game jam, and we built about 108 kind of starter games. And people did wonderful work, but it actually, those games are not really what DeepWell is core and working on. Those games are a lot about informing people what it's like to have mental illness. So we kind of went out to the dev community and they came back with their vision of what we were asking for. And it looked a little bit like training or empathy-based gaming. What DeepWell's really working on is that you might know why you clicked on that game, but if 30 seconds in, you're not immersed in the game and thinking not at all about the mental health condition you're dealing with, we haven't done our job. In a very different way that we want. So our first game is still in development with just amazing legends of gaming and huge talent, the kind of talent that only somebody like a Mike Wilson can make happen, and an amazing medical advisory team that's backing that all up. So we're a ways away from that now. But if you go to DeepWell, DTX.com, that's where you can get on a list, and you can right now you can be a beta tester if you're so inclined to, see how the game works out for you, or we're doing all that kind of stuff right now.
I think it's awesome. And we'll again make sure those links are in your bio and people can access it. But is there anything that we haven't talked about that you want to make sure that you share?
No, I mean, this has really been, I really appreciate it, because this has
Yeah.
been about the things that I'm passionate about. I think that just understanding, well, maybe backing up and understanding what DeepWell really is.
Yeah.
We are here to work with developers, though we're acting as one now. That's mostly just in preparing our tools and systems and processes. We are here mostly to exponentially grow medicinal media and this whole concept of immersive medicine, right? And so we're building tools, and we're looking at ways that we can publish and all the various ways that we can collaborate. So that will allow people to design these games so they're truly therapeutic. Now, I want to be really clear. Games by accident have been therapeutic for a very, very, very long time. Yeah. I'm now talking about where we did not figure out how to make games therapeutic. It was more of a Darwinian process that many people have been working on for 20 plus years, right, that have landed this at these places where you can do it with intent. Mm-hmm. And our job is to help you do it with intent where it actually comes off as a game. It must be fun first, yeah, for our mechanisms to work. I'm not putting down anybody else's. Edutainment has its place. Gamification has its place. We are not gamification, and we are not edutainment.
Right.
We, we don't use secondary game mechanics as a motivation for doing something that otherwise you wouldn't find fun. Right. We live in the world of play and fun, and as a result of that, we both deliver therapy and have found and come to find that we are looking pretty therapeutic too.
Yeah. Right? Excellent. Yeah. So helpful.
So
we'll make sure all that gets in. And I just want to thank you so much for your time. I want to keep up with you because I want to know how things are going as I start to launch out.
Yeah. Read this.
Maybe it'll help you. Maybe there's some lessons in there that'll kind of get you through any of the challenges.
Oh yeah, I mean, you know what? Actually, I think lessons for women entrepreneurs and lessons for neurodivergent people in business are actually kind of similar. Yeah, in the way that you always kind of have to swim a little upstream and be okay with it.
Yeah. I agree. I think my whole life has been upstream swimming.
Well, you landed pretty good upstream. Good for you.
I know. Well, thank you, Ryan, so much for being with us. I'm going to stop our video. I appreciate you. And let me stop.